what's the best non-surgical for fat removal?
Well, the reality is that we can do some things non-surgically for localized fat reduction. I think liposuction is still the gold standard. I think we'd all agree on that. But there's been a great interest in developing these non-surgical approaches because liposuction is surgery, and we have to accept that fact. So the technologies that we're using now use either cool sculpting, which freezes the fat and the body reabsorbs it, or focused ultrasound like liposonics. And that sort of melts the fat, maybe gives a little bit of tissue tightening as well, and then over time the body reabsorbs that as well.
Yeah, so you actually can remove fat by either heating it up or freezing it, and both actually work. And that's what's kind of new today is that these actually do work, but you don't want to confuse that with truly sculpting, because in surgery I'm going to sculpt the area as opposed to just simply focally reducing the amount of fat that's there.
I think with some of the new applicators on the cool sculpting, some of these results that we're seeing are getting closer to the sculpting, overlapping treatments. I think these really hold some promise, and I think they're getting better.
Right, I agree.
Do you think are we able to quantify yet if liposuction's at a certain level, cool sculpting or some of these other non-surgical modalities are at a different level?
As we look at a patient, we have to understand sort of what they're after and how much we need to do. Sometimes it's more cost advantageous to do surgery as opposed to trying to do multiple areas with a non-surgical technique, I think.
I'd like to step back for a second. Yes, we have a superb non-surgical way of removing fat. It's called diet and exercise. And patients need to understand that without diet and exercise and a global approach to their lifestyle, the results of any of these techniques, whether we do liposuction or any of these other adjuncts, aren't going to make a damn bit of difference.
Right.
The other thing is that the results, we want to maintain them as long as we can. We don't want to keep bringing patients back to the operating room. And I think these non-invasive tools is a great way to maintain results for a longer period of time than we could do before.
So the bottom line then is we do have means, non-surgical means, of getting rid of some fat. May not be as good as surgery, but it's pretty good, and it's another nice option to offer patients.
And there's a lot of patients who absolutely do not want surgery, or maybe they're not a candidate for surgery, and it's so nice to have an option for them that's something different than surgery.